Ladies and gentlemen, welcome to the first UBT International Conference on Sports Medicine, organized by UBT and supported by Kosovo Association of Sports and Exercise Medicine, International Federation of Sports Medicine, Kosovo Olympic Committee, Sports, Health and the People, a Western Balkan University network. Dear Rector of UBT, Professor Dr. Edmond Hairizi, dear Professor Dr. Fabio Picosi, President of FIMS, it is a pleasure to have you here today. Dear professors, researchers, and students, the ICSM 2025 conference will serve as an international platform for collaboration and the exchange of professional experiences, the presentation of the latest trends and innovations in sports medicine, the promotion of scientific research and rehabilitation practices, as well as the development of international networks in the fields of sport and health. To officially open the conference, I invite for the opening remarks the President of UBT, Professor Dr. Edmond Hairizi.
Thank you very much. Good morning, dear colleagues, professor, professionals, clinicists in sport medicine, in sport and health, distinguished participants from Kosovo and from international world, dear President of the International Federation of Sport Medicine, Professor Dr. Fabio Picosi, dear Professor Dr. Norbert Bahel, dear Professor Dr. Gobert von Serbetsky, dear Annika Hangleiter, dear Director of Sport Department in the Ministry of Culture, Youth and Sport, Ms. Eiber Alay, dear representative of Kosovo Olympic Committee, Professor Fitim Arifi, dear representative of medical chamber and different chambers in health and sport from Kosovo, and also dear president of the CASEM, Dr. Agim Krasniqi, honored guest, dear media, on behalf of UBT and on behalf of my the FIMS in Kosovo and Scientific Committee, I wanted to welcome you to the first international conference for sports medicine here in Kosovo. So I think it's a great honor today to have this establishment of this conference and this topic as in Kosovo from the point of academic point of the let's say scientific conference, and this is really great. Since the establishment, UBT has been deeply committed to knowledge, innovation, and the creation of a smart society where science, technology, and praxis come together to generate a lasting impact on the community. Sport medicine perfectly embodies this philosophy. It unites health, education, performance, and technology innovation in one integrated field. Through the establishment of the Institute for Sport Medicine at UBT, we have opened a new chapter in the development of the discipline in Kosovo. This center is not only providing clinical service and professional training, but also create a research and innovation ecosystem that directly connected sport with science and technology. As you know, with the great contribution of UBT, we have also succeeded to found the Kosovo Association of Sports and Exercise Medicine, called CASEM, which last year we had an historic momentum to place as on the family of International Federation of Sport Medicine, FIMS, which we become the, let's say, under the 117 members of this society, and it was great. This membership represents the international recognition of UBT and CASEM and Kosovo role in advancing sport medicine and public health, not only in Kosovo, but as of, let's say, in the region and international level. The topics that we'll discuss today and through the conference are quite very interesting, very important. Clinical sport medicine, rehabilitation, management of chronic diseases in athletes, neurological and physiological aspect of performance, as well as a new technology for measuring and enhancing human performance. This discussion will directly contribute to the development of modern practice in sport healthcare, making our athletes not only stronger and more capable, but above all, healthier and more aware about their bodies and performance. The conference marks a historic moment for Kosovo. For the first time, our country becoming an active participant in international dialogue on sport medicine and Olympic health. The presence of the president of FIMS, Professor Dr. Fabio Pigozzi, here at UBT is really a great honor. It's a symbol of this recognition and a confirmation of the scientific and academic standards we are building together. In this occasion, I wanted again to thank President Pigozzi for his great contribution, support on becoming Kosovo part of International Federation of Sport Medicine. Thank you, President. Thank you very much for this. In this occasion, I want also to thank Professor Norbert Bahal, the Vice President, for his advice, support, mentorship, guidelines to bring us on the level of fulfilling the standards and being able to become member of international standards, international families, and today also be able to organize the first conference officially in cooperation with FIMS, which is really an honor. So, of course, I will continue to thank all partners that they contribute on this occasion. Kosovo Association for Sport and Exercise Medicine, the association which will work and promote this area together with all the relevant stakeholders in Kosovo. The Kosovo Olympic Committee, who was always the great supporter from the beginning for the membership, for the cooperation and all aspects related with the part, but of course also the government and other association which let's say we create a small-scale, smart, self-sustained ecosystem in Kosovo as for sport medicine. I'm very happy here to be done. I want another thanks goes also to our partner colleagues from different partner university in our European project called SHAPE, which is dealing with sport, health, and people. It's a great let's say related project that integrate the Western Balkan partners and create a Western Balkan network which symbolize partnership, regional cooperation, strengthening friendship, peace, and also a contribution for growth in the area of sport and health. Thank you for contribution of the colleagues from Vienna, from Rome, and also from Albania, North Macedonia, Montenegro, and other relevant partners. So thank you all, and of course, but last but not least, our organizing team. I thank you all for your great job, from great organization, and for their contribution that we have today, this conference, and I think we will have a great day to have different discussion. A special case, thanks for our keynote speakers who create another value, another level. We will have our 4 or 5 main speakers in the morning session, and then we will continue with a peer review based conference papers after the lunch, and I think we'll complete the conference. This conference, just to know, is under the umbrella of UBT International Conference for Science, Technology and Innovation. We have a tradition now more than 15 years to organize an international interdisciplinarity conference, which means today and tomorrow we have 22 sub-international conference. So the idea is that each faculty is organizing their own scientific conference once per year, annually, peer review, very international based, but the point is that we are all together today and tomorrow, so there is also an opportunity to have a transdisciplinarity approach on this presentation. So it's really great. So, but we will promise we will continue to invest in science, in quality of studies and research and projects that create a direct impact on health and quality of life. I think UBT has created quite a very nice infrastructure and an ecosystem which I wanted to present later, so I will not take too much. So thank you very much, welcome, and I wish you a great success today.
Thank you, Rector Hairizi. Now I kindly invite for a word Professor Dr. Fabio Bigozzi, President of FIMS.
Good morning, everybody. Dear Rector Hairizi, authorities, dear colleagues, ladies and gentlemen. As President of the International Federation of Sports Medicine and on behalf of the FIMS Executive Committee, it is a pleasure and a great honor to welcome all of you, speakers and participants, to the first International Conference of Sports Medicine, organized here in Pristina by the University for Business and Technology, event also supported by the Kosovo NOC and the Kosovo Association for Sports Medicine. The latter has been part of the FIMS family, as the rector stated, as a member national association for exactly 1 year. It was approved last year during the World Congress of Sport Medicine held in Dubai. I would like in particular to thank very much Professor Edmond Hairizi, Rector of the University for Business and Technology in Pristina, for the invitation to this important initiative, which testify his and his university great interest in sports medicine. As we all know, sports includes all forms of human movement aimed at expressing, maintaining, and improving physical fitness and performance, as well as mental well-being and health. Sport also contributes to the creation or enhancement of social relationship during leisure time, competition, improved health maintenance, and the prevention and treatment of various diseases. Sports medicine makes a fundamental contribution to these goals, as its focus is not limited to professional athletes, top-level athletes, but is also essential to amateur athletes and those seeking to manage chronic condition through exercise, thus promoting a healthy and conscious lifestyle for all. Sports medicine contribution is also crucial in addressing specific threats to the integrity of sports competition, including all forms of traditional doping, issues of technological equity, and the integration of transgender and intersex athletes in elite sport. It is also a great pleasure for me in this occasion to invite all of you to the 39th FIMS World Congress of Sports Medicine, which will be held from the 24th to the 27th October 2026 in the beautiful city of Santiago de Chile. Santiago is, as you know, a fascinating and dynamic metropolis, enriched day after day with new attractions that add to its extraordinary historical and architectural heritage. In conclusion, with this spirit and in the name of the International Federation of Sports Medicine, I wish all participants and speakers in this Congress a fruitful work. To Professor Hairizi and the local organizing committee go my personal good wishes for the success of this important international event and to keep on doing the brilliant work done so far. And Mr. Rector, dear Edmond, if you allow me, I would like now to present you as a memory of this event and of the invitation to FIMS to participate to the first international conference, a small momentum, which is the official plaque of the International Federation.
Sorry, just a moment.
you as a placard from UBT.
A change of flags.
Thank you, Mr. Picozzi. Let me invite now the Director of Sports Management Departments in the Ministry of Culture, Youth and Sports, Mr. Iber Alay.
Përshëndetje, i nderuar dekan zoti Ajrizi, të nderuar profesor, zoni edhe zotëri, në emër të Ministrisë për Kulturën e Sport, e përshëndes këtë iniciativë për organizimin e një konference në mjekësinë sportive, e cila është e rëndësishme shumë në aspektin e promovimit të nutricizmit, të fizioterapisë, në aspektin e promovimit të ndarjes së eksperiencave të tjera në zhvillimin e sportit përmes mjekësisë sportive, që është një prej fushave më të rëndësishme në zhvillimin e sportit në nivel vendi, por edhe zhvillimin e talentëve në aspektin e matjeve antropometrike, të cilët ata në zhvillimin e karrierës së tyre punojnë përmes turshqyrit, përmes biaktivit apo përmes programeve biaktiv Life and Lifestyle, sepse është një prej pjesëve më të rëndësishme në shoqërinë tonë. Prandaj misioni i Ministrisë është që bashkëpunim me organizatat sportive, që e përgëzoj edhe Komitetin Olimpik, që ka bashkëpunuar me UBT-n në zhvillimin e një programi të tillë si rast, edhe e përgëzoj në mënyrë që të zhvillohen konferenca të tilla, në mënyrë që të dohen përvojat, eksperiencët dhe punimet shkencore, të cilat e arrisin rezultate në aspektin e matjeve shkencore, në mënyrë që sportit gjejnë mbështetjen e vazhdueshme në zhvillimin e tij, si në karrierën sportive, por edhe në shëndetin publik. Edhe një herë përgëzime dhe urime në këtë konferencë.
Thank you, Mr. Alay. Now it's time for the next speaker. It is my pleasure to invite the representative of the Kosovo Olympic Committee, Mr. Fitem Arifi.
Faleminderit. I nderuar rektor zoti Harizi, i nderuar president senior Fabio Pigozzi, zoti Alaj, të nderuar pjesëmarrës, kolegë, miq të sportit. Bashkëpunimi ndërmjet Komitetit Olimpik të Kosovës dhe UBT-s është i rëndësishëm në dy drejtime. Së pari, për të forcuar lidhjen mes botës akademike të sportit dhe së dyti për të promovuar në Kosovë standardet më të mira ndërkombëtare në fushën e mjekësisë së sportit. Organizimi i konferencave të tilla shkencore jo vetëm që rrit kapacitetet tona profesionale, por demonstrojnë përkushtimin ton ndaj shëndetit të sportistëve, ndaj parandalimit lëndimit dhe ndaj rehabilitimit që përfundon me performancë të lartë sportive. Dua të shpreh falënderimet më të mëdha ndaj UBT-s për iniciativën dhe realizimin e kësaj konference shkencore. Falenderoj kolegët tonë të gjithë pjesëmarrësit të çdo niveli. Student, mjek, trajner sportiv, specialist të fizioterapisë për angazhimin dhe interesimin tuaj. Si dhe ekspert ndërkombëtar, figurat të njohura botërore siç është doktor Fabio Pigozzi, presidenti i Federatës Ndërkombëtare të Mjekësisë Sportive. Kjo tregon qartë se Kosova dhe institucionet tona janë të gatshme të jenë pjesë aktive e këtij zhvillimi. Domethënë është një nder i veçantë për mua të jem prezant në këtë konferencë, sepse është edhe pjesë e studimit tim që gjithashtu në emër të Komitetit Olimpik të Kosovës, në emër të presidentit Ismet Krasni, që juroj punë të mbar gjatë kësaj konference. Ancora, professor Pigozzi, grazie mille per la tua presenza in questa conferenza. Bocca al lupo.
Thank you, Mr. Arifi. Now it's time to invite the representative of KASEM, Mr. Agim Krasniqi.
Distinguished guests, colleagues and friends, Honorable Rector and CEO of UBT, Professor Hairizi, President of the International Federation of Sport Medicine, Professor Fabio Pigozzi. It is a great honor to address you today as a President of the Kosovo Association of Sports and Exercise Medicine, KASEM, at the first UBT International Conference on Sports Medicine. This event marks a significant milestone for our country as we gather to advance the field of sports medicine, elevate the care and performance to athletes. KASEM was founded with the mission to unite professionals in sports medicine, physiotherapy, exercise, science, and related fields. Since becoming a member of the International Federation of Sports Medicine in 2024, we have been dedicated to build connection with leading global institutions and raising the standards of care for athletes in Kosovo. Our vision is to establish Kosovo as a regional hub of excellence in sports medicine, a place where professionals collaborate across disciplines to provide the best possible care and support to athletes. This vision is driven by our mission to improve the health, safety, and performance of athletes through education, scientific research, and evidence-based practice. The core goal of KASEM is to promote sports medicine as a key element in athletes' development. We aim to create a comprehensive framework for injury prevention, rehabilitation, and performance enhancement that benefits athletes at every level from grassroots to elite sports. This conference stands as a reflection of that vision. It brings together experts, researchers, and professionals from around the world to share insight, cutting-edge research, innovative treatments, and best practice in sports medicine. This discussion are established to ensuring that athletes receive highest standards of care, can perform to their full potential free from preventable injuries. I would express my sincere gratitude to Rector and CEO of UBT, Professor Hairizi, for his invaluable leadership and for making this event possible. I also extend my heartfelt thanks to Professor Fabio Pigozzi, President of FIMS, and Professor Norbert Bach for their continued support and their pivotal role in global advancement of sports medicine. Their leadership and vision have had a profound impact on the development of this field worldwide. I also wish to thank all of partners and contribution for this conference. And our goal is clear, to ensure that every athlete in Kosovo, regardless of their sports level, has access to highly quality medical care that prioritizes their long-term health and well-being. In conclusion, I want to express my deepest appreciation to all of your participation, dedication, and contribution to this important field. This conference represents a vital step forward in shaping the future sports medicine, not only in Kosovo, but within the broader international community. I am confident that the knowledge shared here will inspire us all to continue improving the care we provide to athletes. I wish you all a productive and inspiring conference, and I look forward to the positive outcomes for our discussion. Thank you.
Thank you, Mr. Krasniqi. Thank you all for your speech. Now let me inform you that from now on we will continue with the conference sessions and presentations. The panel of keynote speakers is composed of Professor Dr. Fabio Pigozzi, President of FIMS from Italy, Professor Dr. Norbert Ball from Austria, Professor Dr. Edmond Hairizi from Kosovo, Annika Hangleiter from Germany, Professor Dr. Gobert von Skarbensky from Austria. But first, we will continue with Professor Dr. Fabio Pigozzi from Italy with the topic Sudden Cardiac Death in Sports and Exercise.
The remote? Sorry. Thank you very much. The topic of my letter, I would say that is a very hot topic in the world of sports medicine, because it's addressed to the sudden cardiac death in athletes. We have to take into consideration that many efforts have been done in the last years from a scientific and organizational point of view in order to prevent this very tragic situation. Okay. So what is the definition of sudden cardiac death? You know, there are, okay, I have, you know, I am not very skillful in technology. I apologize, dear Edmund. You know, with respect to the sudden cardiac death, we can say that we defined as a non-traumatic, non-violent, and unexpected natural death of cardiac origin occurring within 1 hour from the onset of symptoms in a person who does not have a previously recognized cardiovascular disease. So, according to this definition, we can say that sudden cardiac death may occur during or immediately, oh, thank you. In that direction, okay, now it's, thank you very much. May occur during or immediately after an exertion involving competition or in training. Of course, we have to take into consideration that when we talk about sudden cardiac death, we do not consider traumas or technical accidents during sports activity. In the previous years, you know, sudden cardiac death has been considered really an extraordinary event, but recent data suggest that these accidents are not so rare. The epidemiology, we have to take into consideration that this event is much frequent in people over 35, and the risk in males is higher than in females. And we are also aware that sport increases the risk of sudden death. In this slide, you can see the risk of sudden death in young athletes versus non-athletes is crystal clear, but we have to take into consideration also that there is a different percentages of sudden death according to the sport disciplines. As you can see, in football is higher than in, for example, in equestrian sports. And we have also to take into consideration that in some sports, like basketball, also anthropological aspects related to congenital disease play an important role. With respect to the epidemiology of sudden cardiac death, we have also to take into consideration that in many cases we have with the sudden cardiac death the first expression of a silent cardiac disease. It is not surprising that sudden cardiac death usually occurs during official competition, 75%, and not during training. It's clear that during a competition we have more and more effects of intensive exercise, such as dehydration, adrenergic surge, electrolyte imbalance, acid-base disturbances, which cannot be tolerated in an athlete who has a pathological, electrical or structural substrate. So, you know, we have for this reason to take into consideration very many preventive measures. First of all, which are the causes of sudden cardiac death in athletes? You know, from autopsies, we well know that the most common causes are represented by hypertrophic cardiomyopathy, coronary artery disease, and arrhythmogenic right ventricular dysplasia. Less frequent are disease represented by congenital coronary anomalies, valvular heart disease, dilated cardiomyopathy, aortic pathology, conduction system abnormalities, myocarditis, long QT syndromes, idiopathic VT, and Brugada syndrome. But at any case, we have to take into consideration that we have a different etiopathogenic reasons, causes, according to the age. In fact, with athletes under 35, we have many studies carried out mainly in my country and in the United States where the data are not coincident. In Italy, we have as the most common cause of sudden death, the arrhythmogenic right ventricular dysplasia, and then the anomalous coronary artery origin. We have other causes like hypertrophic cardiomyopathies, less than the epidemiological data we have in United States, where this percentage is much higher, 36%. Why? I will report on this later, but in Italy we have different rules in the pre-participation screening, and I will talk about the fundamental role of a very, very simple test, which is represented by the electrocardiogram. So, young athletes, which are the causes of sudden cardiac death? You know, in the United States is represented by hypertrophic cardiomyopathy. And in some situation, we have, unfortunately, a finding of structurally normal heart. So for this reason, other causes, including doping, have been investigated. You know, and we have also an overlap between the athlete's heart. All of you know that, of course, we have some adaptation to training, the so-called athlete's heart, and sudden cardiac death. We have to understand that the athlete's heart is an adaptation as the muscle skeletal hypertrophy due to the training. The main difference between, and simple difference between pathological and physiological hypertrophy is represented by the fact that physiological is reversible. When you have a pathological hypertrophy, is not reversible at all. And with respect to people over 35, as I said, is most common, the sudden cardiac death, and is due mainly to for 80% of cases to coronary heart disease. So in any case, both for people practicing sport under 35 and over 35 is really, really fundamental, the pre-participation screening. Because the great challenge of sport cardiology is really the minimization of the sudden cardiac risk in athletes. To this respect, we have I have to report that since we had in Italy a mandatory pre-participation cardiac screening program with the utilization of the electrocardiogram, we have seen that this obligation led to a very significant decrease of the incidence of sudden cardiac death in athletes. It has been carried out by a very well-known cardiologist in Italy, Professor Corrado, a survey where he reported that the annual incidence of sudden cardiac death decreased by 89% after cardiac screening became compulsory in the year 1982. To this respect, we have still a discussion about the inclusion in the standard pre-participation screening of the 12-lead ECG, because some important scientific society, consider it really important and to be included in the protocol. Others, such as the American Heart Association, still do not accept that, and this is mainly due to the possibility of false positive. But I would like also to say, as a cardiologist, that in the most common causes of sudden death, both in the United States, hypertrophic cardiomyopathy, and in Italy, arrhythmogenic right ventricular dysplasia, we have around 90% of positivity in the electrocardiogram. So we still continue to insist for the inclusion of the electrocardiogram, which is a really simple test. It has been accepted many years ago and recommended by the European Society of Cardiology, and also the International Olympic Committee published in 2004, so more than 20 years ago, also the Lausanne recommendation, where also the pre-participation cardiovascular screening have been recommended, strongly recommended. As president of FIMS, I would like also to report that we had meetings and contacts with one of our member national association, which is the American College of Sports Medicine, in order to have a consensus statement on the protocol. Many items have been shared. Still is matter of debate, the inclusion of electrocardiogram. But what we have done has been also published 10 years ago in an international peer review journal. So I would like to report about my country experience. Since 1982, we have a mandate by the law that every subject engaged in competitive sports activity must undergo to a clinical evaluation and obtain eligibility before entering. This means 6 million athletes of all ages annually, about 10% of the overall Italian population. And we had previously another legislation which dates back to the year 1950, where the pre-participation screening was considered mandatory only in few sports. But we have an experience lasting more than 75 years, which is also a huge amount of data. Our protocol of the cardiovascular screening is medical history, physical examination, and 12 lead ECG at rest and after exercise in most of the sports disciplines. The step test is a very simple test. In the past was criticized in comparison with a normal stress test utilizing a cycloergometer of treadmill, but is a test it has been re-evaluated in the last years because it is very arrhythmogenic. So for this reason, it's also important to combine the high number of participants which need a test, a preliminary test, and the cost of the test. And this is really cheap as a test, but as a very, I would say, preventive goal, also because when you have some doubt, the law allows you to request additional tests. So for the screening is very, very useful. What is the target of the law? The target of the law is not only the top-level athletes. In most of the country, we have very deep investigation for the so-called athletes belonging to the Olympic team or national teams. Or, of course, Premier League football players and so on. The goal is to address our attention to the 6 million athletes who regularly train and compete. We have, dear colleagues, also to take into consideration that in most of the countries, in comparison with the past, the military service is not compulsory anymore. So is not easy to find a possibility to submit the general population asymptomatic to medical tests. Sports is a good key, the access to sport activity. Also because we have the possibility to visit asymptomatic people. Asymptomatic doesn't mean healthy, means asymptomatic. And for this reason, in many cases, we can detect pathologies when they are asymptomatic, and this means not only a very ethical, important goal, but also a lower social cost for the treatment of the disease when you detect them when they are not asymptomatic yet. You know, I would like also, of course, as president of the International Federation of Sports Medicine, I have also to stress the importance of the goal which have been achieved last year within the European Union. The specialization in sports medicine have been recognized as a full specialization. It's really important because it was a long route. I started this with my first vice president when I was Secretary General and the President of the European Federation. We started negotiation with the European Union, better with the European Union of Medical Specialists, in order to have sports medicine specialization recognized. Because sports medicine is a very unique specialization where you have to acquire competence on the various areas, disciplinary areas which are involved with sports activity. And we achieved the definition of a minimum curriculum, which is the same in any country of the European Union. And we have reached recently the number which allowed us to request the recognition in all the European Union countries, so it's a very important perspective. And, you know, this is a very, I would say, old article which I always project in when I talk about sudden cardiac death, not because I am Italian, because Italy was the first country in 1957 where it was founded a specialization in sport medicine in Milano by Professor Margaria. And you know, it's really important that some preliminary symptoms of sudden death are recognized by the physician. But who is the physician who can recognize it? Those who have experience in sports organization and in sports activity. For this reason, it's really important, and this is also a goal we focused as International Federation of Sports Medicine. Is important to educate specifically young physicians to sports medicine, because it's important to know the real specific aspect which characterized sports activity, and also which can be recognized as, in some cases, early symptoms of at risk of life. You know, the pre-participation screening is not only important to prevent sudden cardiac death, but also to detect other pathologies when they are asymptomatic in order to treat them appropriately. We have to take into consideration that about 2% of the athletes' population is disqualified from competition after the pre-participation screening. Of course, 70% of disqualification are due to cardiovascular disease. So the most frequent are represented by arrhythmias, valvular disease, hypertrophic cardiomyopathy, and hypertension. But we have also other 30% of disqualification, which are, due to pathologies of other organs and other systems. So, very important as pre-participation screening to sports activities, but also from a social point of view as a test to asymptomatic people. This is very important. I would like to stress this. Asymptomatic doesn't mean healthy people. Of course, I already stressed this point before in the previous slides. It's really important for us, and it's not only a point of view from FIMS or from single countries, also very important organization like the European Society of Cardiology stressed the value of the screening for the risk of sudden cardiac death in young competitive athletes. And to this respect, this is a study carried out recently, that of 69 athletes diagnosed with condition associated with sudden cardiac death, 29% had a positive family history, symptoms, and or abnormal physical examination, and 59% had abnormalities on resting 12 lead ECG, important of the ECG, and 52% demonstrated abnormalities on exercise testing. So it's again really important the pre-participation screening program in any country to prevent the sudden cardiac death. Of course, we have also to take into consideration, as I told you, we have a screening with very simple tests, but if the sports physician suspect the disease, usually we integrate with other tests, other examination, like the echocardiography. Echocardiography is also really important. I would like to report on a study I carried out in our Rome FIFA Medical Center of Excellence, where we included the echocardiography in the screening. So it's not in the screening by the law, but we included. We had a support from an insurance company which allowed us to have a big study group, 3,100 male soccer players. And, it was really important for us to report that the echocardiography improved the diagnostic power of the screening, because echocardiography identified 56 previously unknown cardiac abnormalities. So for this reason, of course, we stress this importance. We know that this improves really the cost of a single screening test. So is utilized usually as a second level assessment and not as a first level assessment for this reason. When we talk about prevention of sudden cardiac arrest, we have to take into consideration also the so-called secondary prevention. Why people die for sudden cardiac death? In most of the cases is a ventricular fibrillation, 95% of cases. And to this respect, we have for this reason to take into consideration that the first aid organization in the field has to be very carefully organized, because now we have semi-automatic defibrillators available and very cheap, which can successfully be utilized in the treatment of sudden cardiac death. In some countries, including mine, it's mandatory to have them in the field and in the training camps. This helped a lot, and statistically, in a very significant way, the possibility to treat in the field a case of cardiac arrest. And also, FIFA stressed the importance in any country of promoting the prevention and management of sudden cardiac arrest in football. I would like also, approaching the finishing line of my presentation, also to talk shortly about the relationship between prohibited substance abuse and sudden cardiac death. We have many cases after autopsy of athletes who died suddenly that are considered unexplained death or blanche autopsies. So no morphological normal heart is found at autopsy. And also toxicologic tests are negative or not conducted. We have always to suspect the abuse of doping substances, especially in these cases of deaths of unknown origin. We have some lists published concerning unexplained sudden deaths, where anabolic androgenic steroids have been considered key contributors in these deaths. And we have also to take into consideration that, of course, as I said before, in most of the cases, toxicologic screenings have been negative, but in some cases they have been positive. And we started to study the related risk of doping substances many years ago in order to answer to the question on what is the effect of doping on the cardiovascular system. And I was part 20 years ago of a European Society of Cardiology study group which led to a position paper on cardiovascular adverse effect of doping in athletes. And we had also published in the Journal of Medical Physical Fitness this year another review addressed to the cardiovascular risk of doping and substance abuse in athletes. As you can see, most of the doping substances having an effect on the cardiovascular system can be considered also possible causes of sudden cardiac deaths. And we know that doping substances are active on the cardiovascular system. Most of the classes, stimulants, EPO, glucocorticosteroids, beta-2 agonists, diuretics, growth hormone, and more anabolic steroids, have a direct and indirect adverse effect on the cardiovascular system. And most of these substances lead to arrhythmias, heart failure, and of course then to sudden death. Why? They have both or either direct effect because they lead to hypertension, dyslipidemia, myocyte hypertrophy, and interstitial fibrosis, and also indirect effects like supraphysiological exercise capacity, extreme cardiac remodeling, exercise-induced cardiac injury, and interstitial fibrosis. So in both of the effects, we have clinical consequences, so an increased risk of arrhythmias, heart failure, and sudden cardiac death. So when we talk about prohibited substance abuse and sudden cardiac death, I would like to list a few take-home messages. We have to be aware, being engaged as physician, as athlete, support personnel, including coaches, that performance-enhancing drugs have a direct and indirect adverse effect on cardiovascular system. Athletes may use a combination of different drugs causing additive effect on heart and vessels. That doping-related cardiac alteration may lead to arrhythmias, heart failure, and sudden death. And in the presence of sudden cardiac death in young athletes, this is very important, or in athletes with heart dysfunction, misuse of performance-enhancing drug should be always suspected. So the importance of pre-participation screening. A preliminary screening is not only to submit an athlete to an ECG or to a measure of his blood pressure. It's more and more is also to be in touch with an athlete as a physician and to have a right anamnesis. It's really important to see any problem which could be, let's say, related to an assumption of forbidden and, of course, dangerous substances. So with this take-home message, I would like to thank you very much for your attention, and of course, again, thanks for your invitation. Thank you.
Thank you, Mr. Picozzi. Now it's time for Professor Dr. Norbert Ball from Austria with the topic Sports Medicine as a Specialty in Europe, Shaping Precise Prevention.
Okay, dear rectors, dear authorities, dear colleagues,
This one is easier for you.
No, I take this. This is fine. Okay. First of all, it's a great pleasure to be here at the first International UBT Symposium on Sports Medicine. Great to be invited. Thanks for the invitation and the hospitality of UBT. Secondly, I want again, on behalf of FIMS, in my position as Vice President, but also personally, extend my congratulations to Kosovo to have founded the Kosovo Association, the National Association of Sports Medicine, and become member of the FIMS family, and also to have opened an Institute of Sports Medicine here at UBT, thanks to the effort of Professor Harisi. So I also have some problems. Yeah, it's not working, so what? Okay, to become member of the FIMS family. You know, FIMS is a global player with a lot of different items in his mission statement, and I want to highlight for today, for my presentation, 2 items: to preserve and improve the health of mankind through exercise and sports participation, and secondly, to scientifically study the natural and pathological implications of physical training and sport participation on the one hand, but also of physical inactivity on the other hand. Well, it was already stated that we had a great success in 24, that sports medicine was recognized by the European Union as a full specialty. This is a great step forward for sports medicine internationally or on European level. But in addition, it's very important to say and to state that all other European countries are obliged to implement sports medicine as a specialty in their own country, which will be a long way, but it's never too late to start. So I'm happy to say that in different countries we are doing the first steps that sports medicine is also recognized as a full specialty. And this is the implication out of the specialty, that sports medicine acts or has to act as a lifelong health promotion and health care. And this was written down in the publication in the Medicina dello Sport, and I want to cite some of the aspects for today's talk here at the Congress. And please accept that my talk is, let's say, more a little bit health political talk than scientific talk. But I think it's very important to show you how sports medicine in general, but also as a specialization, can pervade different settings of our daily life. So I don't think that I have to go deeper into the details of the physical inactivity. You can see that around 30 to 35% of the population is inactive through long periods of sitting every day, with a projection that this percentage will rise up to 50% in a few years. And only 30% are exercising irregularly and about 20% regularly. In addition, it's very worse to say that 81% of the adolescents do not meet the necessary activity levels for good health and growth. And that means that chronic diseases, NCDs, will be the leading causes of increased morbidity and mortality, so we say, from the exercise deficiency syndrome to the sedentary death syndrome. And the last line shows the impact of that, the consequences of that. It will cost a lot of money, about 47 trillions by 2030. So let's show first the very famous publication 15 years ago from Pedersen, the diseasome of the physical inactivity. You see that physical inactivity causes adiposity, causes macrophage infiltration in the visceral fat, and causes chronic systemic inflammation by cytokines. And depending on the, let's say, genetic precondition, that can cause diabetes, cardiovascular diseases, cancer, depression, and so on and so on. And the good message is that movement, the activity, that contraction of muscles can counteract this by sending out the myokines into the whole body. And this is the positive message, and this is also the reason why sports medicine is the preventive medicine, because of its pleiotropic effect. We say sports medicine is acting like a polypill, and therefore we have a very positive influence of all organs, organ systems, including nutrition, including mindset, mental health, and stress resistance. And just to show you one example of a very, very recent publication, if you see the highest cardiorespiratory fitness in yellow on the left-hand side from the slide, causes the lowest ratio of multimorbidity, which is a very, very hard, let's say, expression of the last years in life. So that means that preventive health care and precise prevention is very necessary for that, means multidisciplinary and multi-professional cooperation between sports and exercise medicine and different other sciences like nutritional science, sports science, and other medical disciplines to, let's say, improve the health of the population. This is true for all life stages. For the childhood, for toddlers, for the adults, and for the older adults. And you can see the key facts, you can see the recommended intervention, meaning especially physical activity and nutritional and also stress reduction, and you can see the expected outcome, which in all phases of their life will be a very positive result of the intervention. And to, let's say, summarize this, in 23, a global alliance framework for the promotion of physical activity was founded within a Hamburg Congress, and we have a lot of publications out of that. But I want to show you which institutions are involved. Health politics, IOC, FIMS, EFSMA, the National Olympic Committees, the National Federation of Sports Medicine, national ministries. So a lot of stakeholders who are responsible that sports medicine can act as a, let's say, preventional measure in all countries. And out of that, and now starts my, let's say, health political talk, out of that I want to show you 10 different levels of intervention, 10 demands, 10 different settings where sports medicine has to pervade their life. First, to establish the specialization in sports medicine in all European countries, implementation of the corresponding training curriculum, the accreditation of the training centers, as well as the corresponding trainers in accordance with the UMS, this is the European Union of Medical Specialists, requirements are prepared and given. And now there's, in my last sentence in this slide written, at least National Federation of Sports Medicine should offer a sports medicine diploma with a European-wide unified curriculum. And ladies and gentlemen, that might be the next challenge for your federation, for your national generation, to establish such a diploma course to educate young people, young physicians with sports medicine contents. And be sure that EFSMA, that FIMS, and also my country will help and support you in this way, installing such a sports medicine diploma. Well, the next level of interaction is irrespective of the decision of the specialization, it has to be mandatory that sports medicine content, especially prevention-oriented content, must be integrated in the training curricula of all medical universities in all European countries as a mandatory examination immanent basis. Very important that during the education they learn about sports medicine, about the advantages of physical activity. The second or third is the postgraduate training. Independent of the specialization, if somebody does not opt for a specialist in sports medicine, he should work for a few months as part of a of his postgraduate training in an institution in which one doctor has the specialization or at least a sports medicine diploma of the National Sports Medicine Association. And the same is true if you are working in a primary care center, although there should have one doctor, a specialization in sports medicine or at least a sports medicine diploma. Why? To advise all patients in all categories of diseases or in prevention, to advise patients how to act, how to integrate physical activity into the daily life. And again, I show you a very recent publication, the global burden of cardiovascular diseases expressed in dailies in disability-adjusted life years. And you can see on the right-hand part of the slide that despite all activities, worldwide activities, the number of cardiovascular diseases expressed in dailies are increased by 40% in males and 28% or 30% in females. This show in another way how important it is to advise patients in physical activity. And as an example, I show you a publication of the American Heart Association with the title, The 8 Essentials Lifestyles. And you can see that they have physical activity, diabetes, also blood glucose, and a lot of parameters listed up which should be detected in a sports medicine, basic sports medicine examination. And they differentiate those parameters in health parameters or health behaviors and health factors and calculate a score. And you can see that the score can go from red to green, should be green for sure. And if you're out of that, it's easy to give exercise prescriptions for health, advise the patients, advise the people, and it should be personalized, preventive, participatory, and predictive. Well, this is the exercise prescriptions for health, summarizing the advices in endurance training, in strength training, in coordination and balance training, and it should be motivational, which is very, very important. And there is a very nice guideline. You can later on reflect on that. It's called the SHARE guideline. Seek your patient's participation. Help your patient to explore and compare treatment, physical activity options. Assess your patient's values and preferences, very important. Preferences maybe are very individualized. Reach a decision with your patient and evaluate your patient's decisions. So to be motivational in training advices is very, very necessary and important. The next setting is schools. So all schools doctors should be educated in sports medicine or should have a diploma or should be specialists in sports medicine to supervise the activities, projects, and implementation of daily exercise sessions in all schools. And there is another aim and item which is very important, to have the sports medicine evaluation or the pre-exercise evaluation very early, beginning after 8 years. And this is also very important to add to this sports medicine investigation, nutritional advices and also psychological contents. This is in order. Also, this is a flow chart of the pre-participation examination, as Professor Pigozzi has shown you already, so I can jump that. But this is very important, that the pre-participation examination, this also discussed by Professor Pigozzi, has also to prevent sudden death. And a standardized sports medicine examination done from a specialist in sports medicine or having the diploma is very important to reduce the sudden death or to prevent sudden death. And you have seen also this slide from an Italian region where the investigations were mandatory and they dropped down the sudden death rate to non-athletes or even lower than that. So the hospitals is the next setting where sports medicine is very, very important. So every doctor should specify in his report not only the medical therapy, not only the medication, but also an exercise therapy in addition to the course. And secondly, in all hospitals should be, let's say, included fitness center to the Department of Physical Medicine to realize a very, let's say, a physical activity during inpatient time and to motivate the patient to continue physical activity in their rehabilitation phase. This is a very, very recent publication, how to implement physical activity for inpatients in a so-called active hospital. And I can only recommend you to read this paper. I will just cite the conclusion. It has been possible to create a sustainable model to increase physical activity, but the change in culture on the ward and staff engagement has been the key. Last but not least, our seniors. So one doctor in the residences, all senior citizen residences, should be a specialist in sports medicine or even have a diploma to advise the elderly persons in the age-appropriate physical activity. Well, there are two major risk factors in the elderly. This is muscle atrophy, this is sarcopenia, this is sarcopenic obesity on the one hand, and on the other hand, the falls, the risk of falls, and the fractures. Well, there are a lot of young people in this auditorium, but I can tell you it's never too early to meet your tomorrow. So think about that. So saying this, sports medicine needs for a long life health promotion other sciences like systems medicine, omics, digital health, and artificial intelligence. And my intention is let's take action in our future depends on that. And I just want to show, and Annika will show you later more extensively, some technological infrastructures for a precise prevention. This is the basis to give the precise advices for your patients. And you can see that there are different possibilities, wearables, artificial intelligence, sensors, and so on, for data integration, for, let's say, monitoring the data, to make also disease modeling or health modeling with avatars and so on with screens. So a lot of possibilities giving from the digital era we are now facing. And just one example, artificial intelligence listens for health conditions. The speech recordings or voice recordings examined by the artificial intelligence might provide new biomarkers for the detection of heart disease and Alzheimer's. So it's a very great challenge with these new aspects of diagnosis. It's not perfect at the moment, but it will develop in the future. So summarizing precise prevention. The digital technology from artificial intelligence, digital health tools, multimodal omics, robotics to extended reality and data-driven platforms will in future transform prevention, diagnosis, and care delivery. It will change our thinking and will change our acting, but always only as a helping hand. The personal contact between physician and patients is mandatory. All those can be helping hand. And to come to the finish of my talk, we can speak using all those systems from a smart health ecosystem, and looking at the UBT United Hospital and UBT campus